getting a television show on there.
Mm-hmm.
Good evening. Welcome to Healthy Alternatives, where we explore complementary and alternative health care modalities, as well as other lifestyle choices that promote and enhance human health. I'm your host, Lauren Serven, and our guest tonight is Joanne Panciera, excuse me,
That's
from
okay.
Tree of Healing, which is the Center for Integrative Holistic Wellness,
Right.
located in Rocky Hill.
Right. Celestine Highway.
Celestine Highway in Rocky Hill. And tonight we're going to be talking about something that I don't think many of us really consider a healthcare modality, hypnosis, which is, I think we have a lot of misconceptions about hypnosis, sort of
Right.
Alfred Hitchcock and very spooky, scary. But so before we go into what you do, we always like to talk about the person themselves and how they've come to do the things they do. So,
Well, where do I begin? I've been in the metaphysical field or the metaphysical arena for approximately 31 years.
now can you just explain to people what you mean by metaphysical?
Metaphysical, someone who deals on the spiritual level and uses different modalities, work with angels, spirit guides and all of that. And being a metaphysical therapist is someone who is able to tune into someone's energy field, pick up certain things around them. And also, I'm also a metaphysical teacher as well, where I teach workshops on different things that are connected to spiritual work, where I can talk about angels. I do self-confidence workshops. There's just many, I can't remember offhand, but there's several different types of workshops. But the spiritual arena is the key. Okay. And so I just say metaphysical.
Is kind of like things that are beyond
Right.
measuring with instruments
Right.
or
Right.
other types of diagnostic technology.
It's
say?
something. Yeah, it's something that I felt was connected. It was the right, if you will, title for me because of the work that I do. Because I do a little this and little that. And when I was a child of 9 years old, I would see energy around people, and I thought it was very natural to see auras. Didn't know they were called auras.
So what did these things look like? Can you explain?
Well, I would see like colors. And sometimes I would just see a light energy around them, and that was it. But I would know something, but didn't know how I knew what I knew. Sometimes when the phone would ring, I would know who it would be. So I thought this was natural, and down the road realized that none of my family really understood all of this. They thought, well, she's kind of strange here.
Right.
And so I've had many different experiences, but I would have angels that would come to me, or spirit, and they would come in all energies of flicks of light all around me, and they were my friends. And
would they say things to you, or
they
you
would just
receive some sort of a message from them?
They would just make me feel loved and let me know everything's okay and you're safe, and that you're not alone. And I did. I felt alone because of the gift, because nobody understood what I was experiencing.
Well, certainly you're perceiving life in a totally different way.
You're talking about 30 years ago.
Right, which, now it's still, I mean, I think, some of our viewers may even think,
Yeah.
Yeah, but it is becoming more accepted.
I didn't know what to do with it. And I just met a wonderful mentor who helped me understand my gift. And I was probably about 20. And he said, Joanne, you're a clairvoyant. I said, what the heck is a clairvoyant? He said, the word clairvoyant means clear vision. That means you're able to read someone's energy field. You're able to see it, not only feel it, but able to see it. So I took some classes to help understand the gift. Little did I know I was going to come back out and doing what I'm doing. Not exactly what I'm doing today, but back then I didn't know where I was going to go with it. So to make a long story really short, I started doing readings. And I've been known for many years doing readings. And
now, when you say readings, this is about something that's going on in someone's life, helping them through a transition, or would this be even more like what's going to happen to them? Or?
It's when I read a person's aura, whatever I see, it's reading what they're putting out there into the universe. So I tune into what they're experiencing now, what's coming up within the year. Nobody really can predict your future, you know. Sometimes I can see if there's an illness, if there's something going on in their physical body, which is a lot to do with their emotional body. And so I just tell them what I'm picking up and what I see. Yeah. And then from there, with the readings, I started getting involved with Reiki healing.
Which is now very mainstream.
Oh, extremely. And I just I thought that, what am I going to do? I don't want to do readings the rest of my life. It's just, I felt that's not who I am. I'm supposed to do something else with this gift. And then I was able to connect it to energy work. And so when I work with Reiki healing or crystal healing, whatever energy work I do, I'm able to see if there's a problem in the body and what it may be. And find out that there was an emotion that was connected to that illness.
Right.
And once they realize what the emotion is, if they're ready to heal it, they'll heal it. So it's pretty interesting. Like I had a lady a couple weeks ago, and it wasn't an illness. I just was scanning her body, and in her stomach area, I kept getting acidic. And come to find out, I kept seeing oranges. So I said, have you been eating oranges? And she said, and she started laughing. She says, I can't stop eating oranges. The last 3 days, that's all I've been eating. I said, stop eating them because it's causing problems. And then I kept seeing meat. And this woman doesn't eat meat. Very rare does she eat meat. So she said, I started eating meat. And she says, I have noticed the difference. So her stomach was distended, and I can see that there was a lot of acidic to it. I don't know how I know. I just know. I just feel it. I just see it, and I have to trust it.
So you go with it and trust it.
I have to go with it.
Exactly.
Because this is a gift that I'm supposed to do something with to help people, help themselves.
Well, it's fascinating, and I just want to mention to the viewers that in 2 weeks, we're going to have you back on our show, and you're going to talk more about this whole aspect of energy healing and your gift and how you use it to assist people.
Right.
But tonight's topic, of course, is hypnosis.
Hypnosis.
So, you know, I think, myself included, people have a lot of misconceptions about hypnosis and even somewhat fearful of it, especially, you know, with espionage and, you know, Big Brother and mind control and... but that's not what you do. That's not anything about the hypnosis that you do. So why don't you just start explaining to us?
I got into the field. I've been doing hypnosis now maybe 26 years, somewhere around there. And the reason why I got involved in hypnosis many years ago, different than the reason why I'm in now. But what hypnosis is and what I love about it is everybody can be hypnotized. And people will say, no, you can't hypnotize me. Well, I'm not planning to hypnotize you. You're planning to hypnotize yourself. So, you know, I always say to people, do you ever get in your car and you're driving from A going to B and said, how did I get here? That's called highway hypnosis. That means your conscious mind was distracted and your subconscious mind ability is heightened more. So it took you where you needed to go, even though you felt like, how did I get here?
Exactly.
So I think everybody has experienced that.
Yeah, I know I have. Much to the chagrin of some people on the road. But definitely.
Anybody who's driven has experienced that. Daydreaming. You know, gazing out the window. You're in that hypnotic state. That is called self-hypnosis. So what I do is, and I know that some people have fear of hypnosis, and that's because of what they see on TV and what others have said. And when I have people come in, I sit down, I explain to them how I do the hypnosis. And the first thing I tell them, or one of the first things I tell them is, you're going to be putting yourself in that hypnotic state.
Well, that's a very important...
You're going to be doing 80%, I'm only going to do 20%.
Right.
So what I do is I teach them self-hypnosis. It doesn't matter what they're coming to me for. They can come to me for smoking, weight loss, nail biting, anxiety. It doesn't matter what they're coming to me for. each person that comes to me, they are taught how to do self-hypnosis.
Okay.
So if you like to experience self-hypnosis, would you like to experience it?
Oh, I certainly would. Before I do, though, if we could just talk a little bit more about maybe what someone will experience when they come to you. So let's say, for instance, someone is struggling with an issue, anxiety or depression, which is, so rampant.
That's a big one.
Most
anxiety.
of our medication is oriented towards these types of problems. Do they necessarily? They don't necessarily have to reveal to you. It's not like it's a therapy session.
No, I do get a lot of people for anxiety, and the sad part is I get a lot of teenagers, early 20s, and so again I teach them how to release their stress or their anxiety through some post-hypnotic suggestions that I give them. And I teach them the self-hypnosis first. So as they're relaxing, as I'm telling them what to, suggesting what they can do for themselves, they automatically feel like this is right, this feels comfortable, I'm just going to continue to go even deeper and become more relaxed because it feels right, and they just kind of surrender to it. So their conscious mind is focused on that relaxation, where their subconscious mind's ability is heightened, and that's where I walk in and I implement positive suggestions to the subconscious mind. Because you cannot implement positive suggestions to the subconscious mind if the conscious mind is right. So if I can explain to you the difference, this is your subconscious mind, and your subconscious mind is like your hard drive on your computer.
Okay.
It's on 24/7. It knows everything about you since you were born. It has the files on you. It knows all the pain you went through. It's got everything on you.
So it's your whole entire history.
Yeah, your entire
and
history.
For this life, and maybe even
many lives. Yeah, oh, definitely. I didn't know if you wanted to go that far.
No,
but it's true. It does remember past lives and all that. And this is your conscious mind, and your conscious mind is only awake when you're awake. So in order for me to implement positive suggestions to the subconscious mind, I have to distract the conscious mind. So as I'm telling the person to relax and be calm and whatever else I'm saying to them, what happens, this is what happens, the subconscious mind ability heightens. It becomes more aware. And so because the conscious mind is over here in La La Land thinking about the ocean and being at the beach. Whatever it is. And then I walk in and I implement positive suggestions. However, if the subconscious mind doesn't like what's being said, it will reject it. That's where free will, free choice comes in.
Oh, okay. So it's not totally disconnected
from
what you would maybe consider, would that be considered the conscious mind?
Yeah. So, if you don't like what's being said, you just reject it.
Okay.
And so in the beginning, I like to talk to my client. I like them to find out a little bit about them. I want them to get comfortable with me. I don't care how good of a hypnotherapist you are. If that person's not comfortable with you, they're not going to do what you're telling them to do.
Right.
So I want to make sure that person is feeling very comfortable and they feel safe and all of that. And then once I start talking with them, they start telling me a little bit about what they want to work on. And they kind of tune into their energy. I do a little bit of clairvoyance. I do tune in a little bit with them. And because not everybody that comes to me for hypnosis is open to my, to my gift. So I just kind of follow my instincts and trust it. Even when I teach, I always teach from the soul. Very rare can I teach from the text. I have a hard time teaching from the text. I just have to teach from here.
So it comes from a place inside.
Yeah, it's just trusting it.
Yeah. Let's just talk a little bit about maybe some of the other, for our viewers especially, some of the issues that they could come to you for. Because truly, I think that it is self-hypnosis, so it's very empowering that you're helping someone discover things
tremendous
about themselves and really take control of some issues that might be plaguing them. You could just list all the different commercials on TV for the various medications and go down the list. So now anxiety and depression, those are more sort of mental things,
right?
Are there actual, and then you mentioned pain. This woman had discomfort.
Yeah, I do work with pain. Sometimes people come to me for many different reasons for pain, and arthritis,
Arthritis, really?
Really, because there's obviously it's inflammation and it's causing discomfort in the joints. You know, pain could be a physical injury that happened to them. And there's usually an emotional component that's connected to it. So sometimes with arthritis or some kind of inflammation they have, sometimes people take some kind of
anti-inflammatory.
Yeah, right, and that's fine. But if it's an injury or if it's something else, usually arthritis is always connected to it. But sometimes there's fear that's connected to it. It could be many reasons why that emotion is connected to it, and it's hard for them to let it go because they feel they deserve it.
Really?
You know, some people feel like I deserve this pain because I did this or that in my life.
Oh,
there's many different reasons.
Now, what about like asthma?
You
Breathing difficulty.
Well, again, I don't see a lot of people for that. I do the self-hypnosis for that, but
because that's what I mean. You would think, especially, you know, certainly people have inflammation in the lung and that's causing their breathing. Yeah. But you would think that if they were able to relax more, that would...
I would teach them to relax, but I would really prefer to talk with their physician. You know, the left hand should know what the right hand's doing and get the permission from the doctor. And
do you work with? Do you find that you have partnerships with patients?
I have some
physicians.
Yep.
And they're open to that?
There's a couple physicians I work with and a couple chiropractors. You know, I get referrals here and there. I like to work more with physicians. I really do, and especially chiropractors. I really like to work because they work on the physical body, and I would work with the emotional body to find out what's causing it. Sometimes people don't know why they have an injury or why they're having, some people come to me and they have tumors. You know, that's something we talk about in a couple weeks, you know, when I do the healing work. And again, that's an emotional component that's connected to it. But hypnosis is really teaching you to listen to your body and to be present. And we're always running around. We're always busy doing so many different things and 4 or 5 things. It's crazy. So I teach them how to breathe, take the time to breathe, and to say what they need to say to themselves, and then their body automatically relaxes. And because the body remembers how to relax, it knows how to be calm. But we don't take the time to take care of ourselves because we're taking care of others. Or we're taking care of, you know, work or family, or
we're always attending to something outside.
But what's important is we need to be mindful of taking care of ourselves. It's about self-care. And if we take care of ourselves, not only are we going to feel healthier, but and be good to ourselves, but we can help others. We can still help others, but we need to do what we're doing for them the same.
Right.
So it's teaching a person to know that they're just as important as anybody else, and that they're honoring themselves by taking the time to do this for them. And then I teach them that self-hypnosis, and it only takes a minute or 2. And imagine if they practice it every day and did it every day and took the time for themselves and put themselves first, and then say, okay, now that I did my self-hypnosis or my meditation, now I could, you know, go on and do what I need to do.
It's almost like you're oriented in a more positive direction.
Yeah, and you're more focused. You're in tune with yourself. You're not running away from yourself. You're not running away from your pain. You're in it, and you're breathing through it, and you're letting it go because you're in the present moment.
So you teach your clients to perform self-hypnosis,
right.
And then this is something that you suggest they do every day, or whenever they feel they need to, or how does that work?
Well, it depends on what they're coming to me for. Okay. So if somebody is coming to me, for example, for smoking, and I get many people that come to me for smoking, and it usually takes once or twice. They don't have to come more than twice, but most of the time it's at least one time. And what I do is I have them, I find out what their triggers are, and then talk with them about, you know, what smoking does for them. And they'll say, well, it calms me down. I say, really? Yeah. Oh, okay. Well, let's try something. So I'm going to have you relax yourself. And then I have them sit down and I have them say a couple of things to themselves. And then I'll say to them, it only takes a minute, did you notice a difference? Do you feel that's more calmer than the smoking? They said, yeah, there's a big difference. So smoking doesn't really calm you. You think it does, but it really doesn't. It's just a habit. It's something that started a long time ago. You know, years ago, I was a smoker. And I know exactly why I smoked. I was an athlete. And I remember I couldn't play basketball anymore because I hurt my knee. And my knee would give out on me when I was playing soccer. And I remember going to the girls' room and everybody was smoking. And I started smoking.
It is kind of enjoyable, actually.
Yeah,
it's like
and I did enjoy it.
Yeah, it is.
I really did.
Yeah.
So just one day I said, that's it. You know, I'm ready. I cannot, do hypnosis, and I didn't at that time, for smoking for people if I'm a smoker.
Exactly.
So then I had quit.
Right.
And I really did enjoy it, though. But I understood where they're coming from because I've been there. You know. So even when someone comes for weight loss, the same thing. But it takes 3 or 4 times when they come to me. Some people lose weight right away, which is good, but they need to be consistent with it, and it's usually something that's holding them back. Maybe their emotional body's not ready to let it go, because maybe their emotional body says, well, we need to hold on to this because we're not worthy to drop that 20 pounds. Because sometimes women especially feel like they're not worthy enough or pretty enough.
So I'm hearing from you that this is really a lot about self-acceptance.
Oh, yeah.
So all these different things that we suffer from with our health,
we've
or
done
our
it.
Emotions, it really boils down to self-acceptance.
And that's why I believe in self-love. And the more that you keep projecting love to you, the more you'll heal. And so, I've learned that.
And I do think, most people would think that, that's narcissistic, or, we aren't raised to think that way. Or,
well,
even our religious institutions,
but if
everything is oriented outward.
I know, but it works. That's the only thing that heals is love. Nothing else heals.
And truly, if you don't really, or if you're not capable of loving yourself, I don't think you're really capable of loving.
Yeah, you think you may love that
person. Exactly.
And what is love?
And it might be, love to a certain degree, but it could also be very selfish love, or, sort of.
Some people don't know what love is.
No, they don't.
And the way you treat your best friend is really the way you should be treating yourself. So if you're treating your best friend with love and support and guidance, you should be doing the same for you.
For yourself.
Absolutely. Absolutely.
Right.
So, again, people come to me from all walks of life for different reasons. Sometimes people come, they have an exam, they're having, a hard time studying and focusing, so they come to me about, how can I be more focused?
Yeah, distraction is something that plagues a lot of people.
Well,
we've got this ADD and ADHD, and what's going on with that?
I know there's a lot of distraction. That's why I believe,
and it's not just children. It's grown-ups.
That's why I believe that meditation is very important. It teaches you to be present, to be in the moment, and to really feel what your body is feeling and what your emotions is telling you, as well as your body, and to connect with that and breathe through it, and keep sending love to your body and say it's going to be okay. I'm worthy. I'm self-confident, I'm this, I'm that, I'm loved, where the old beliefs are saying, you weren't loved when you were younger. So that sometimes people come to me for that, and I regress them. It's called regressive hypnosis. I bring them back to the time where they didn't feel worthy of themselves. And so, we dialogue, and then you instill the new beliefs. What do you want to feel? I don't tell them what they need to feel. You tell me what you want to feel. Well, I want to feel more confident. I want to feel more worthy. If someone comes to me for weight loss, I had a client that had a hard time getting rid of ice cream. She says, I can't stop eating ice cream. I could do everything else, but I can't stop eating ice cream, and I didn't understand why. And she had to have ice cream almost every day. So I said, well, what does ice cream make you feel when you eat it? It makes me feel good. I'm happy. I feel really good. It makes me happy. She kept saying that. I said, okay. So I regressed her back to the time when she started eating more ice cream, or that feeling came upon her. And she was 9 years old. She was in the hospital, and she just had her tonsils out. Her mother comes in and said, oh, I know what you will need. I know what you want or what you need. And she gave her a bowl of ice cream. And so I said to her, when being very young at that time, when I was regressing her, what would you want your mom to do for you? I wanted her only to give me a hug and tell me that that's going to be okay. That's all she wanted. The mother didn't ask her what she wanted. The mother assumed that she wanted ice cream, because if you think about it, if you have your tonsils out, most mothers, either the doctors or nurses,
everybody's telling
they
you
get
have
ice cream.
Right.
But to me, that's negative. It's not necessarily ice cream. I can understand the cooling part of it. It's maybe being a little girl, you just wanted to know that you're loved and you just wanted that big hug. That's all she ever wanted. So when she came out of hypnosis, she said, that's all I really wanted. And she no longer touched ice cream after that. Because she knew it was not what she wanted.
Right.
And she realized that that's all she wanted was a hug.
Wow.
Really interesting.
It must be fascinating, too.
It is. I do a lot of inner child work, too, when people go through a lot of abuse in their life and the things
that would really be people suffering from then some sort of trauma.
Oh, yeah. There's a lot of trauma out there.
Have you had any veterans come to you, or?
Mm-mm.
No,
I haven't.
Post-traumatic stress, or people who are maybe victimized in crime or things like that?
No. I've not, no. I've maybe there might have been a couple people.
But certainly you would probably help those people.
Yeah. And you have to remember, too, a lot of them there could be under a lot of medication. And when there's a lot of medication involved, it's very hard to...
You kind of can't get through the subconscious, Joanne?
Yeah, because it's hard for them to stay focused.
Okay. So they're really just being numbed out.
Unfortunately.
With the meds.
Yeah.
Which, maybe provides some time for some sort of psychic healing, but certainly you don't want to be staying on those forever.
I think that they need to work with their therapist and work on the healing that way. And once that the doctor says, sure, we can include, hypnosis, that's fine. But I don't.
You would just encourage someone who's under that kind of psychiatric care, medication.
However, I have worked with people with Reiki healing with trauma.
Really?
So that's different because, you're not putting them in that relaxed state. So that's a little bit different. And so I know that they're going through the trauma, so I just bring comfort and clear out what needs to be cleared out in their energy field so they could see things a little bit more clear and feel better about themselves. Sometimes there's a lot of lost souls out there. They need to know that they're loved and that someone cares about them. And they just need to learn how to care about themselves. Sometimes they don't. So I have many people that come for many different things, and self-confidence is a big one. I have a lot of people come to me for self-confidence.
Now you have self-confidence workshops?
I just had one a week, actually this past Saturday.
Tell us what's involved with
it's creating a healthier self-image workshop.
Okay.
And I had about 12 students there. And I talked a little bit about self-hypnosis and about self-confidence. And then I put everybody in that hypnosis state. And it was amazing. I went around the room, and there's one girl her head went right down. She was just so hypnotizable. It was unbelievable. She's highly suggestible. So someone that does that means they're highly suggestible. And the more highly suggestible someone is, obviously they're a good candidate for hypnosis. And so I was very pleased to see that. So they got a lot out of it, and I provided a CD for them as well. So
that is something that you provide to your clients when they come to you.
Yep.
So it's not like you've got to go and it's like 20 weeks and, maybe you'll stop smoking.
Right. When someone comes to me for smoking, it's usually, like I said, once or twice. And I always provide a CD, and they bring that home and they listen to it every day for at least 30 days because it takes at least 21 to 30 days to establish a new belief or new habit.
Oh, okay.
So what it's doing is reinforcing all the positive suggestions that are being made at that time. And so some people walk out the door and they'll quit, but they won't listen to the CD, but they're fine. Or some will say after a couple weeks, well, Joanne, I'm noticing that I'm starting to have the urge. Well, have you been listening to the CD? No. Got to listen to it.
Right.
So I want them to at least listen to it. Not only will it help reinforce the suggestions, but it'll help them to teach them how to be relaxed and calm when they are becoming anxious or when they do become anxious or uptight.
All right. So now, let's...
Do you want me to hypnotize you?
Yeah.
Well, I can show you, or I can explain to you how, let's say you're coming to me, and Lauren, and I'll say to you, okay, Lauren, what I'd like you to do is, before we begin, I want to explain to you how you can relax your state, or put yourself in that relaxed state. So I'll have your feet flat on the ground, and I'll just have you close your eyes. So if you want, close your eyes, and just take a couple deep, slow breaths. So take a nice deep breath, and slowly exhale through your mouth, and take another deep, deep, comfortable breath, and slowly exhale, allowing yourself to relax. Good. Focus on your breathing. And as you're focusing on your breathing, I want you to do something else. In your mind, very quietly, very softly, I'd like you to say the words calm, relax yourself over and over. Calm, relax, calm, relax. And you might notice as you're saying those words that your body begins to relax more. You might notice all of a sudden your shoulders will droop. If they don't, that's okay. But if they do, that's okay. And you might notice that your facial muscles are so relaxed. Even your eyes, that you can barely open your eyes because your eyes are very, very heavy. Because you're very relaxed, very calm. So you can say this to yourself if you like for another minute. And you're going to notice that your muscles and your body will just accept and love those words, calmness and relaxation. Because that's what your body wants more, what it needs more. For you to be calm and relaxed in everything that you do in life, no matter what it is. And anytime you become anxious or uptight or stressed or worried or bored, all you have to do in your mind, say the words calm and relax at least 3 times, and you'll automatically feel the way you feel right now. Very calm and very relaxed. So open your eyes. And did you notice any changes?
I felt my face sort of
relaxed.
Relaxing.
Yeah.
Yeah.
See, now
and I felt something in here.
What did you like? Like what?
Well, it just felt good.
Good. Well, you were letting go. Maybe some tightness was there without realizing it. And I think if you were, leaned back and sitting in an upright chair, I think you could be able to relax a little bit more. Sometimes it's kind of hard to be sitting like that.
Right, no, with no support.
Right, and it's important that you have the support. But see, that was self-hypnosis. So if you wanted to go deeper, now I use this technique a lot. And my husband would even say to me, when I get really uptight, he would say, yeah, it says, Joanne, calm and relax, or count down from 10 to 1, that type of thing. And so this is something that everybody can do. So if the audience wants to do that, is they just have their feet flat on the ground and say the words, calm and relax, slowly, quietly, softly, soothingly. I can just put myself in that relaxed state. And as you're saying that, you just want to go like this.
Right.
And when I teach it, when I taught the workshop, my body was starting to relax. I'm saying, nope, I can't relax because I have to teach this. I have to explain to people this. But you can't help that because when you're doing hypnosis on someone, you can't help but relax. Notice how my voice got very soft and very relaxed. I was kind of tuning in to you, and what I was saying, it was just coming very natural. So I have this room in my office, and I call it the healing room. It's purple. My husband painted a couple years ago, and I have people in there for hypnosis. I don't even want to leave the room because it's just a very soothing and relaxing room, and I do my meditation in there. So they're in that room, and sometimes I don't even want to leave because they're just so relaxed.
Right. It's the energy is good.
Yeah, it's the energy in the room. So,
and I think, Joanne, does it help for the people that come to you? We've all had moments in life where we've been calm and relaxed, or we've felt calm and relaxed, whatever the occasion was.
Yep.
And so that's almost like a recognition of that.
Mm-hmm.
You can, sort of help that person reconnect with those feelings. Because we certainly reconnect with negative feelings. So, why not the positive ones?
That's the thing, where, those are chatter, I call them the chatter. The chatterbox where the negative energy comes in, especially a woman. When I do weight loss on people, it's funny. I'll say to them, "Well, when you exercise, or when you look in the mirror, or whenever what do you say?" And 9 out of 10, it's always something negative.
Nitpicking. I don't like this. That,
well, right,
right.
It's
exactly.
And so, but if you can and your body's saying, "Okay, you don't like it. Well, we're going to keep on looking this way." But if, sometimes when I put lotion on in the morning, I'll just go like this. I love my body. I love my arms. I love my legs. You need to embrace your essence. You need to embrace who you are. You need to love all of you, not parts of you.
Right, even the things
and it's challenging.
It is challenging.
Yeah, I mean, anything that we do, but it's just being mindful of what you're saying to yourself creates what happens in your life.
Well, certainly, and being mindful of what we say to others.
Yep.
It's exactly the same.
Well,
you wouldn't talk to someone the way you necessarily might be talking to yourself in your head.
Right. And, but that's why it's important for people to be in the present moment, is to think before they say something. And how does this feel? When I say this to this person, and the way I'm treating that person, why am I treating that person that way? The criticism can come out. There's that part of you. So there's a lot to it, but I think the key of it all is if you can just be kind and loving and gentler to yourself, and just love who you are and just accept who you are, and just practice that every day. I love me. I'm worthy. I am this. I am that. And the more that you keep saying that, the more you feel. And it's interesting because one of the workshops that I put out there is called Celebrating Your Magnificence. And I just loved it. It was something that was channeled through me, through spirit, and I just put it together. And I saw the transformation of people right away. It was wonderful. And it's surrendering and just allowing, you to be who you are. Just surrendering, letting go, and not resisting. And when you let things go, things come to you quicker. Things come to you easier. And we always want to try to control things. So in the work that I do, I have to trust what comes to me. And I used to question it for years. And I said, why am I questioning? It's going to make more sense to them if it doesn't make sense to me. And I just, whatever comes, comes. And if it doesn't make sense to them, it will in time. So I have to trust that.
So in other words, you're working with someone and an idea will come through.
Yeah.
And you don't edit it. You just are going to...
No, I don't edit anything that I say. Because when I do talk with people, it comes from my heart. It comes from my soul. I don't analyze it. I just go from here. Sometimes I know things I don't know how I know it.
Well, I think that's what I was trying to get at Joanne. It was like it's almost like you're being, not like you're being told, but maybe you are in some way.
I'm connected to the
divine. You're like a channel.
Yeah, exactly. I co-create with the divine of the highest light, and I call them in, and I call in the angels, and I call my guardian angel.
Now, do you teach others to do this kind of thing for themselves? Is this part of the hypnosis, or would this be...
Not the hypnosis, the workshop I do on learning to develop your psychic ability or your intuition. Because everybody has gifts, everybody has intuition, they just don't know how to tune into it.
Or they don't trust it, or they're like, oh, I don't know, the rational mind kicks in, and then, then usually there's a huge storm over that.
Yeah, they don't trust it. It's amazing the different people that come to me, and all walks of life. And we're talking about police officers, we're talking lawyers, we're talking about nurses, we're talking about big corporations, all kinds, and for different reasons. And they know what they're getting when they come in. I don't hold back on anything. I'm true blue, and I say what I feel, and I come from integrity, and I'm known for that. And I've been in the field for many years, and people know that about me. I don't play games. I wouldn't want someone to do that to me. And I want what they want for themselves. I even want it more for them. And when I see the difference when they walk out and they quit smoking, or they drop 30 pounds, or whatever it may be, or they're feeling good about themselves, or they stop biting their nails, oh, that's such an euphoric feeling. It's just, you couldn't pay me for that. It was just a wonderful feeling to see that they did it. They reached their goal and they're happy.
Yeah, it's almost like you're sort of like a life coach.
Yeah, a lot of people say I'm a life coach, right? Or spiritual coach or whatever.
Yeah, it's just, a realist to assist.
Yeah.
Right?
Yeah. Just the different modalities. I don't believe in titles and labels, and, I am who I am. I just take my gift and I'm guided to do what I need to do to help others. It certainly has helped me in my life to become who I am today, and I'm always going to be the student as well as a teacher. Right. I love to learn, and to help myself grow so I can help others do the same. And, I also eventually want to work with children, too. I work with children with hypnosis.
Now, what kinds of things do you do with children in hypnosis?
Well, sometimes children come because, it could be many different reasons. One in particular is one little girl was having a hard time sleeping at night, and because of something that happened to her. So I worked with her a couple times. One was a little boy that had a hard time being around animals because of an incident that happened to him. So I was able to help him with that. And it was interesting. I'll never forget this other little boy. He came in and he wanted to lose weight.
Really?
And he really wasn't that overweight. He was only like 11 years old. And
just maybe
he was just a cute little thing. And he just wanted, he says, I want to lose weight. Kids are picking on me. I says, I'll tell you what. Would you like to have more? Would you like to have self-confidence and self-worth? He wanted to know what self-worth was. I said, well, to love who you are. Do you want self-confidence? He said, yes. I said, I guarantee if you have self-confidence and you feel really good, you're going to drop that weight. And he did. So I focused not on his weight. The reason why he had his weight on was the self-confidence, or that he wasn't worthy enough. And he did. And he just had this light in his face. He just lit up, and he felt so good when he walked out the door. He says, I have self-confidence now, and I'm worthy. So I never forgot. That was a few years ago. I never forgot that. And he dropped that weight.
So it's really like you're actually helping people just clear out a lot of negativity.
Yeah.
Right?
Yeah, it's to help them to let go, that it's okay to let go, which is not always easy for many of us.
No, it's not easy to let go.
It depends what they've been through.
Exactly. I mean, I we hold grudges and
I've been
there. These transgressions or something has frightened us, and then it almost becomes part of our being. It's like, well, I'm afraid of this, or I don't do that. We place these limitations on ourselves.
Yeah, we do. Yeah.
Exactly.
Yeah. I just love what I do, and I feel blessed and grateful every day that I do what I do.
No, I think it's absolutely fascinating that, it almost, it's sort of like, it's almost to me like a whole nother realm of, what's the word I'm looking for? Defining who we are as human beings.
Right.
Almost sort of like an evolutionary progression, don't you think, Joanne? Like this whole awareness that we have this power, we can do these things for ourselves.
We have the power, and it starts with loving who we are and accepting who we are. And the more that we keep loving ourselves, the more we're going to feel better, the more we heal. It's just like, I had a little girl today who was 6.5 years old that came to me for Reiki. And she was a little nervous. She didn't know what to expect. And so I had her on the Reiki table, and she'd been having some problems in her stomach. And her mom has come to me for Reiki. So I said to her, okay, just put your hands, on your stomach. And all I want you to do is just send love. So I was doing a little self-hypnosis, because sometimes I combine self-hypnosis and Reiki together. So she did that, just send love and tell me what you feel. And she said, my stomach's feeling better now. I said, so when you feel that discomfort in your stomach, it's all you have to do is send love. In fact, go to your heart and do this and say, I love me. I love me. I love me, over and over. So And as I was working with her, I was watching how she was reacting. Now she's 6.5. So you really want to start when they're young, that they're worthy, and all of that.
And isn't it sad that someone that age can feel unworthy? I mean, they haven't had life's.
But I don't know if she was feeling unworthy. Oh. But I'm just saying is, if a child at that age had been feeling unworthy, you can talk a lot about that. But I I didn't know if she was feeling unworthy. Oh, okay. All I know is I felt like she was carrying the world on her shoulders, and she's 6.5 years old, and I felt like she was worrying a lot, and she's so young, so I wanted her. She believed in angels, and so I said, she believed in God and all of that, and I says, well, you can always talk to God, and you can always talk to the angels, but send love to yourself. And then I would say to her, what's your favorite color? And she'd say pink and purple. Well, just imagine this beautiful blanket of light all around you. It's the angels holding you, telling you that they love you, support you, and they'll take care of you, and that you're okay and you're enough. That you're enough. So,
well, I think that's a great message for anybody, isn't it?
We're not told we're enough.
No.
And I like that. I'm enough. I am enough. And I say and what I say to you is what I do. And I say affirmations. And I had this thing to write. I had this feeling to do this, to write an affirmation, the same affirmation for 30 days, every month. And as I was writing it, I would feel what I'm saying. And I did it for 10 months, and I was done. Now I'm working on other things. And it really made me feel good about myself. I am healthy, I'm strong, I am fit. I am this, I am that, and so on. And I remember when I got to stop doing I am wisdom, I really miss writing that and saying that and feeling that. So I said to myself, well, I could still say it over and over, that type of thing. So,
as we're talking, I'm drawing a lot of parallels with, Eastern philosophy, Buddhism in particular, which I know a lot more about than other.
I do believe in that. Yeah.
But it is that whole concept of compassion for yourself.
Absolutely.
And appreciating who you are.
Right.
Because you have this nature that's really the core of your life that becomes obscured.
Yeah.
So it almost sounds to me like what you do is help people wade through all that crust that's sort of in there for whatever reason, and that certainly is a topic of great debate, but and just help them to recognize what that feels like, Joanne, right?
Yeah.
So, because I think a lot in society and how we approach problems, especially in Western society, it's all up here and rational and figuring out and very empiric. This happened and that happened and this and that and this. And certainly there's something to be learned from that, but I think we don't trust, like you were saying, that intuition, that feelings are really not given a lot of credence. And people think feelings as like an emotional state, but I think the feelings that you're talking about that's not just like an emotion, like an anger. It's not a specific feeling, but it's like that feeling that sort of almost really sort of mobilizes us. Right? Or immobilizes us if we're totally disconnected.
Everybody has intuition, but not everybody knows how to use it. I think people use their intuition more than they think they do, but they don't always trust it. Do you ever second guess yourself? I said, I should have done that.
Oh, yeah, like all the time.
Yeah.
And it's usually your first thing is always
That's the intuition. It's the first thought. So when I taught the self awareness class, and I would tell them, write this word down, and this is the first thought that comes to you, and then I would say the question, and they had to write it down right away. I said, that's your intuition.
Yeah, no time delay.
Right. It's the first thought that comes to you. How do you feel about yourself? First word. Write it down. So it's really learning to trust, because everybody is born with that gift. Some are more open to it than others. You know, some people are more kinesthetic. They can feel. You know, they're called empaths, and they can pick up energy from other people.
Yeah, so it's more like a thing that you feel. Like,
right.
So, in other words, you actually see things.
I see and
feel things too.
But I feel, but I actually am. I see a lot, but I'm not considered an empath. But I can feel. Mm-hmm. And
so there might be probably for a lot of people who are walking around feeling various levels of discomfort, and where are these feelings coming from? Maybe they're these empaths and they just don't even realize it.
I know, and I've had clients that come
in and you're like, "Where am I feel this. I did," and maybe somebody's saying something to you, but you're not feeling that from that person, and that leads to all kinds of confusion.
That's why I always, believe that when you, meditating. I always call an Archangel Michael. I always call him the Big Kahuna. I call him every day to protect me, to guide me, no matter where I am, wherever I go. Mm-hmm. And I always call, the angels for protection as well.
So in other words, if one is venturing into this territory, you shouldn't be so arrogant as to think that you don't need assistance.
We all need assistance. In fact, for years, I can do this, I can handle this, I can handle that, and I never really allowed anybody to help me. Mm-hmm. And then the last few years I said, I should allow myself to have people support me. And now I just love it. I have so much more support now in my life than I ever have. And I'm grateful that I allowed myself to experience it. I have the most wonderful, wonderful friends that and colleagues that they're just very, very supportive. And clients, I can't tell you how many wonderful clients that have been coming to me for years. And I learned so much from them as they learned from me. Because we're all mirrors of one another. Mm-hmm. We all are mirrors of one another. Mm. So I learned from them and they learned from me.
That's great.
Yeah.
Well, I really look forward to having you back.
Great.
In 2 weeks.
I'm looking forward to that.
And we're going to be doing that. So maybe you'll do a Reiki session? Would that be something you're comfortable doing?
Sure. I think that would be a good idea. Mm-hmm. I could do that. Yeah.
I'm really interested in talking about these, will you call them angels?
Angels.
Entities or whatever
right.
that are around. And maybe sometimes those are what we're feeling in our lives
right.
and we just don't know it.
I think there's always angels around people, but they don't. We all have a guardian angel. Every one of us does. But some feel it and some don't. But that doesn't mean they're not around.
But they're not there.
You just have to ask. That's what they're there for.
Wow. Mm. Well, I really look forward to our next show, and I really enjoyed learning about hypnosis and a couple of issues that I think I could probably benefit from. So anyway, thank you so much.
Thank you for
being
having me.
And
your hands are warm. Mine are cold.
I know. When I came in, my hands were cold.
I know. Mine were warm.
We did some kind of energy shift.
But you hear the light.
Anyway, but thank you so much.
Okay,
and thank you for tuning in. And please come back and see us in 2 weeks when Joanne comes back. Thanks. Good night.